Good morning, I'm Jules. Thank you for joining us, and a warm welcome to our guests too. Sir Roger Gale, the Conservative MP for North Thanet, and Karen Constantine, the Deputy Leader of the Labour Group on Kent County Council. Also Charlotte Wright, our political editor. Let's start by talking about Wealdon MP Nusgani. Pretty explosive, Charlotte. What exactly is Nusgani claiming?
Well, this all dates back to February 2020 when Nusgani was sacked from her ministerial job in the Department for Transport, and she met with Government Whip to ask about why. Now, she's given this interview to the Sunday Times where she says that she asked for an explanation and the Government Whip told her Muslimness was raised as an issue. Apparently her status as a Muslim woman was making colleagues uncomfortable. This is what she said in this interview with the Sunday Times. She says she dropped the matter after being told that if she persisted in asking about it, she would be ostracised and her career and reputation would be destroyed.
Aside from the very specific claims that Nusgani has made about Conservative whips, there has been a swirl of allegations this week, hasn't there, Sir Roger, about current Tory whips who've been, well, the claims are they've been particularly heavy-handed. I know you're quite a tough nut, but have they ever overstepped the mark with you?
I don't think they'd bother, frankly. Jules, I'm too long in the tooth to be troubled by the whips.
Let's bring it back to the southeast, if I may, for a moment. How will this play out? There are important elections in May in places like Worthing and Ada and Tunbridge Wells and Maidstone. I've had people who are standing in those elections, some of whom have told me that they fear going into these elections with Boris Johnson still as leader. What do you think will happen in those elections if he is still the leader of the party?
I think the chances are that we shall take a hammering in the local elections. And if that happens, then we shall lose some very good, very hard-working local government politicians who are delivering on all of their promises, but who can see a Prime Minister not delivering in the areas that matter to the man in the street. Probity does matter, honesty does matter. The status of the United Kingdom in the world and its Prime Minister does matter. And for me, it's quite wrong that local politicians should pay the price for the things that we screw up nationally. But the fact of the matter is, I'm afraid, that is what happens. So I would like to see a new Prime Minister, a Conservative Prime Minister, obviously. We're not talking about Keir Starmer, who doesn't cut the mustard at all.
Well, I'll tell you what, we are going to talk about him. It's time to bring Karen Constantine in. Labour are up in the polls, but is that just temporary rage against Boris Johnson rather than a positive move towards your leader, Sir Keir Starmer?
I think it's a positive move towards Keir Starmer, and I'll tell you why. Because we've just had bombshell after bombshell after bombshell about the Tories. We've got a cost of living crisis, we've got a COVID crisis, we've actually got a Brexit crisis, we've got an 8-mile tailback in our region, in Dover. Brexit hasn't worked. It's driven up the costs. People are now beginning to see that what they were promised hasn't materialised. And that is why somebody that's cool, calm, composed, somebody that lives out his values, somebody that doesn't drag around with him a poor previous bad reputation is now starting to do well in the polls. And it is time that I think that what we need to do is not only do we need a new Prime Minister, it's actually time that we had a general election. Coming out of COVID, moving forward, we need to have better people running the country.
Karen, you talked there.
The Tory government are tin-eared, callous and uncaring.
You talked in your answer about a COVID crisis, a cost of living crisis and a Brexit crisis. If all of those things really matter, then why did your leader at Prime Minister's Questions this week focused almost entirely, almost every question he asked was about the number 10 parties? People are saying they want to hear about other things. You're saying other things matter. Sir Keir Starmer doesn't get it, does he?
Well, the issue of the Partygate is important because the detail in this is important, because we have had scandal after scandal. The latest one, we've got Nusrat Ghani coming out and saying that in effect what she's saying is the Tory is Islamophobic. You know, we've got a Prime Minister that described Muslim women as letterboxes. So there is a track record here. This does go back a while. What the Conservatives need to do is they need to come clean We shouldn't have to wait really for Sue Gray's report. And who does Sue Gray report to? She reports to Boris Johnson. So it's time, with regard to the Islamophobia, that the Tories referred themselves to the EARC for a proper investigation, a full, impartial, independent investigation to get to the bottom of that.
Most of the time, when you're in hospital, you want to get home as soon as possible, but too often there are delays in getting people back to their normal lives, even when they're medically fit to leave. Back on the 13th of December, there were about 830 such patients across Kent, Sussex and Surrey, unable to leave despite being fit to do so. Now, the NHS promised to cut that number right down by a third, but that simply hasn't happened. Instead, the figure actually went up to over 950. Karen Constantine, earlier this month, all of our councils in the South East received this letter, didn't they? They were told to try and support the NHS in getting these medically fit patients out of hospital. To be blunt, was that ever feasible? Was it a futile exercise? How much can the councils really do at the moment?
I think it was a good ambition to have, but actually it probably was always going to be futile because we've got some significant issues. And again, after 11 years of Conservative rule, we still haven't cracked this very difficult nut. You've got a situation in the South East where staff turnover in the care sector is running at 44%. So as fast as you get staff in to do these jobs, they're leaving because there are other jobs that they want to go to. What this means is you've got people in hospital that desperately need to come out to get well at home, to recover and recuperate, which is exactly the right place for them. You've also got the other side of that, which is you've got people that are sick and ill that need to go into hospital that can't get into hospital. So this is an absolute catastrophe. But it isn't a catastrophe due to COVID. It's a catastrophe that's been brewing for quite a long time. And again, we've seen the government do absolutely nothing about this, and passing the buck down to local authorities and local health services to try and solve what's a national problem and a national scandal just isn't good enough.
Right, let's put all of that straight to Sir Roger Gale. Your response to what Karen's just said about 11 years of Tory rule.
This is a long-standing issue. I could say just as facile a fashion that the 10 years of Labour government did nothing about it either.
Karen.
This is ridiculous what Roger is saying. This is absolutely, he calls me facile. That's the most facile answer I've ever heard him say. This is not a problem that's happened by accident. This has happened by design. This hasn't just happened. This has been brewing up over all of these years. We warned the government that when Brexit was enforced, that many of those workers that were in our care sector, that were doing these really valuable jobs, would have no reason to stay and would depart back to other places, Poland and East European countries. And that is exactly what they've done. They voted with their feet. And now 66% of care home providers are closing their doors because they can't take the volume of patients coming out of hospital because they can't get the staff. This is a perfect storm. But
the government, it's not as though the government is doing nothing. The government's putting £500 million into improving training and qualifications, which they hope will make care a more appealing place to work. They've also added care workers to the shortage occupation list, meaning that more visas are available for care workers to come here. That's all stuff that the care sector has been calling for, isn't it?
It's bolting the door after the horse has bolted. They were warned that Brexit would bring this on. They were told there would be a massive crisis in workforce. And that is exactly what's happened. And it takes a long time to train people up. Even in the most basic jobs, it takes time to bring them in, to get them on, to onboard them properly and to get them to be able to do
it. So Roger, you wanted to come back in.
I do appreciate that Ms Constantine...
Hold on, Karen, hold on one moment.
I do appreciate that Ms Constantine cannot resist the attempt to score party political points with every breath. But the fact of the matter is we have had and still have a COVID pandemic that is preventing people from travelling.
You two taking pot shots at each other may be entertaining, but it's not necessarily edifying. So let's look at what might happen next. Karen, you're calling for a national care service. Just in a couple of sentences, what does that mean?
It means that we would fix the workforce by looking at what we can do to promote and support workers in the workforce, what we can do to support those employers. We would invest in that. We would put money into that to make sure that people are coming in and seeing it as a valuable, viable career. And that means raising the wage rate, and that means putting training and development into place. But the most important thing we would do is we would have ambition to solve this problem for once and for all, because we've got an ageing population. So we're not getting younger as a population, we're getting older, and we're going to need more care workers, work going forward. And I am always stunned that care work in the UK is so undervalued, whether that's childcare or elder care or looking after people that are sick and ill.
Okay, we're going to pick up on how certain jobs are paid in our next story. Thank you both. We're going to move on to another area where people are talking about their conditions. It's been a good week for people in Eastbourne, where a series of bin strikes is now over, and an even better week for refuse workers, some of whom are going to see their pay go up by 20% over the next 2 years. But will their success inspire others to take to the pickets? Karen, I know you actually used to work for the GMB union. Does that mean automatically you're sympathetic to the bin strikers?
Well, I've worked with bin men, so I do have some sympathy with them because I know quite just how difficult their jobs are. They're not pleasant jobs to do. But let's remember here that what's happened is we've had this race to the bottom where wages have gone down and down and the cost of living has gone up and up. And now people are coming together in collective action, which is their right to do so. And coming together, they are louder and more powerful in speaking to the bosses or the companies to get pay on the table and to have a proper discussion about it. And the drivers there have only come up to the average wage for drivers. We're not talking about excessive amounts here. £13.50 is not an awful lot of money, you know, and one of the things we're going to have to look at is how we improve low pay. And let's not forget that that low pay is spent in local economies. So all of that money goes back into the economy. It helps other people. It helps the capital.
Okay. Thank you both very much indeed, Karen Constantine and Sir Roger Gale. Also to our reporters, Ben Weiss, and to Charlotte, who was with us earlier. Thank you so much for watching. I'm back next week. Enjoy the rest of your weekend. Bye-bye.